My name is Sruthi Anbalagan, and I live in Mechanicsburg, Pennsylvania. I decided to focus my topic on the differences and the effectiveness between braces or clear aligners because I would like to be an orthodontist when I grow up. So I figured gaining more of an insight in this field would help me trigger or see what my passions are in this field. So I did braces or clear aligners. So for my abstract, an individual can have different ortho applications, along with the braces to achieve aligned teeth, and it will not affect the braces' function. In this review, many aspects of orthodontic treatments, including time, cost, and aesthetic outcomes, were compared and contrasted in clear aligner therapy versus traditional braces. To elaborate, braces have more force in aligning teeth than clear aligners because braces cannot be removed by the patient themselves. The cons for braces are aesthetics, food choices, brushing teeth, and even more visits to the dentist. Braces are not aesthetically pleasing to most people because of the metal brackets that are placed on teeth. Food choices also become a problem because with braces there are restrictions on what can and cannot be eaten, so the braces do not break. Brushing and flossing the teeth can be hard because some places cannot be cleaned thoroughly due to the metal brackets. In addition, if a wire was poking an individual's mouth or a bracket came loose, the individual would have to go to the dentist more frequently. Clear aligners also have pros and cons. The pros of aligners follow the cons of braces. Clear aligners are aesthetically pleasing, no restrictions on what can and cannot be done, or what can or cannot be eaten, no problems with brushing teeth, and an individual will not have many problems with clear aligners that would result in the individual visiting the dentist frequently. This research will be connected through many articles or slash journals that have already addressed this topic, and the sources picked will be through contradicting views on clear aligners and braces. Both orthodontic methods serve a similar purpose in aligning the teeth to their correct positions. So braces were invented in 1819 and have been used for treating teeth ever since. Braces were the original tools orthodontists had used for correcting teeth, and this was just not for straightening the teeth, but also used for fixing any crowding in the teeth. In addition, braces were made in a way that cannot be taken off from a patient itself. It would have to be taken out by the orthodontist. This ensures for the full effective treatment the braces can provide. Aligners, on the other hand, were invented in 1997, but have only gained a recent surge of popularity recently. Clear aligners still provide the same effect as braces, which is to straighten the teeth, but the pros and cons are a little different. Clear aligners are more appealing to patients because of their aesthetics. Clear aligners are just clear molds that fit a patient's teeth perfectly, so it can be taken out whenever wanted, like for example, eating. Clear aligners give the patients a choice for whenever they want to take it off. Though they have this option, some patients may be misusing it or taking advantage of it, which then results in them forgetting to put it back in, or just because they do not feel like it. This results in the orthodontic procedure to extend, and the full effectiveness of the clear aligners cannot be used. Both of these orthodontic treatments for straightening the teeth are effective, but they both have their own certain list of pros and cons to them. The current research fields between clear aligners and braces have shown many perspectives on which treatment is the most effective for straightening teeth. Though both treatments are good overall, there are pros and cons for each orthodontic method. Braces are suitable for all types of treatments in one stretch. Different ortho applications are available along with braces to achieve aligned teeth, and it will not affect the brace's function. For example, a patient can have expanders in their mouth as well as prevent the crowding and for making more space in the teeth to become aligned. They also have more force in aligning the teeth than clear aligners because braces cannot be removed by the patients themselves, as stated before. The cons for braces and aesthetics are food choices and brushing the teeth, and braces aren't aesthetically pleasing to most people because of the metal brackets, and food choices also become a problem, as mentioned before. And clear aligners also have the pros and cons, but ironically, the pros of aligners follow the cons of braces. And a con for clear aligners is that the patient will need several trays of clear aligners to ensure straightened teeth instead of just in one sitting with the braces. So for the materials and methods, my articles were chosen from non-biased views, so the most accurate data and results could be collected. Though each article had similar varying data, they all had sections on the pros and cons of each orthodontic method. Most of the pros and cons were related to the effectiveness of the treatment, cost level, and overall talked about which one is better suited for that individual specifically. Some articles found that few good points made in them. However, the articles overall were biased towards one side and seemed like they were making the reader push towards that side by stating and supporting facts only towards that specific side. In addition, these articles were filtered through some criterion factors while doing the research. The factors were that articles should be reliable, unbiased, and the articles should somewhat clearly define the ways of how one method may be more advantageous. Most of the articles found did mention and explain the importance of both clear aligners and braces. This allowed me to go on further into reading the article because it would be a waste of reading something that's not going to be useful in the long run. Reliability is important because then the reader can know whether the information being presented was factual or not. And few articles from dental companies were included in the data because it talked about the importance and it was not biased. And the company itself was a legitimate company, so the information could be trusted. Viewing whether an article is biased or not is crucial also because then the research and data will not be skewed to a certain side, which can affect the overall research. As mentioned before, the articles had clearly defined the pros and cons that could determine which method could possibly have more advantage than the other. The thought process that was aimed was to figure out whether braces or clear aligners were the better option for aligning teeth. Even though some individuals can only have one option due to different configurations in their teeth, for example, a person's mouth is crowded, so expanders would have to be put into place, then braces would be the better option in that case. But for the majority of individuals, the main problem is crooked teeth, and either braces or clear aligners can both solve this problem. The original thought that was that the braces were better because it does not restrict the freedom to remove it whenever wanted. This would be better because then the treatment plan for that individual could be done in the time frame predicted. If an individual has the freedom to remove the aligners given to them, then the treatment plan would keep extending out because the teeth would not be aligned properly. So the concluding results that is that both braces and clear aligners are good in their own ways. It really depends on the individual what kind of treatment they need based on alignment of their teeth and or any other things to fix. For certain individuals, braces would be a better choice, whereas it might be clear aligners for others. Different factors were taken into account while concluding the results in which treatment was better, even though it depends on the individual. Cost, effectiveness, and pros and cons all developed a result in why both these treatments are good. The results had stated the yearly cost average for orthodontic expenditures and the cost individuals have been paying yearly. The study had data varying from 1996. However, most recent years have shown how the cost has increased in orthodontic treatments for aligning teeth. Another peer-reviewed article had data illustrating different ethnics or cultures of an individual and how that might be a consideration factor in deciding an orthodontic treatment. The key part from this research paper would be how the source of income is a factor in deciding which treatment to go with, as depending on the type of treatment needed. It depends on each individual. Clear aligners are produced in different thickness levels, which include 0.020, 0.025, and 0.30 inches. 0.03 inches, excuse me. The thickness of each aligner is designed based on what needs to be aligned in an individual's teeth and the severity of it. Clear aligners do help achieve straightened teeth while keeping an aesthetic look, which is a big turn on for many individuals. A previous study that was conducted parallel to this had concluded that clear aligners are effective in getting a result straightened teeth. However, these aligners do not necessarily provide the same effective result on occlusal contact. A study done by Kravitz had mentioned how only 41% of the predicted tooth movement was achieved. The most effective movement was lingual constriction, 47.1%, and the least accurate was extrusion, 29.6%, and only 33% of predicted rotation correction was achieved. To elaborate, clear aligners did not help in fixing occlusal contacts, it rather made it worse. In addition, while it may seem easy for the individuals to get easy, quick results with clear aligners, the movement of teeth is hard, especially for the lower canine tooth. It has been noted that using clear aligners when an individual has extraction cases, the angle of the root aligned with the clear aligners can provide adequate results. However, it is imperative that the proper attachments are used. Adding on, time efficiency is a factor in determining which orthodontic method may be better suited. Time efficiency is important for both the patient and the orthodontist because the patient would want results quickly and the orthodontist can focus on getting more patients. Both of these methods have positive time efficiency. However, the braces method is better in this case. A study conducted by the Bushang and his peers concluded that the total treatment time was found to be 67% lesser in the Invisalign group. The short duration of treatment with aligners was asserted um, with the absence of the finishing and detailing phase, which can take up to 6 months with fixed appliances. On the contrary, in extraction cases, Invisalign treatment duration is 44% longer as compared to fixed appliance treatment. In result of the study, fixed appliances such as braces has better time efficiency when regarding the entire process, but clear aligners provide an advantage for less chair time, meaning the orthodontist can see more patients in a day. However, this advantage is only pertaining to the orthodontist. When time efficiency is compared, braces are the better option when compared to clear aligners. There are many different types of braces, each containing a special aspect. They can range from $3,000 to $7,500, and metal braces can ensure proper teeth alignment, and the time frame can range from a few months to a few years, including some extraneous situations. In addition to metal braces, rubber bands are also placed to help add pressure and ensure clear alignment of the teeth. The other two types of braces are ceramic braces and lingual braces. Certain braces have average cost between $4,000 and $8,000 and relatively are $1,000 more than the standard metal braces. The reason for an increase in cost compared to metal braces is not because of the functionality, but rather appearance. And all the results concluded from different research papers have concluded that overall depends on the patient itself. Though each orthodontic appliance has pros and cons, each is designed in a special way that benefits the patient. So, as mentioned before, there are many factors that get into this, like time and cost. And as stated before by the University of Chicago, the standard metal braces can range from $3,000 to $7,500. And many research papers that had included cost as one of the criteria mentioned how clear aligners are a bit more expensive, but they all tied it with how it depends on the patient. One research paper by BMC Oral Health had gotten their data from controlled trials and cohort studies. Here they found that braces are better for certain problems such as producing adequate occlusal contracts, controlling teeth torque, etc. Certain strategies were also included in the eligibility criteria for what was to be allowed to be used as valid data, like clinical studies on human with permanent dentition, or studies involving treatments with clear aligners and fixed appliances, and much more. In addition to the inclusion and exclusion criteria, study selection and data extraction was included as well. There were two investigators who would look at the study and make some decisions. However, if there were any disputes, then a third investigator would come into play, like a mediator. Another research paper by the University of Chicago talked about the cost and the time frame and how the time frame can be used as a criteria as well. And other papers also showed how time, cost, and other factors were also a factor. So both orthodontic treatments, braces and clear aligners, have positive and negative aspects. Braces are better for long-term requirements and for time efficiency. Clear aligners are better for aesthetics and proper alignment of the teeth. Though both of these methods are special, it is not established that one method is more effective than the other when talking about the overall conclusion. A certain method would be better because of how teeth are placed, and this is not the only constraint. Other problems could be like overbites, underbites, crowding of the teeth, etc., and all these would have to take it into consideration. So, future experiments can also be navigated to find the importance of an orthodontic appliance and how each of these appliances work specifically towards a problem. This can help further expand on this research topic as it widens the differences between the appliances and can be used to determine which one might be better, though it depends on the patient as of now. And these are my references. Thank you.